arteries supplying the heart. The heart is basically supplied by two coronary arteries arising from the ascending aorta, and both the arteries are running in the coronary sulcus. Features of coronary arteries: the blood flows through these arteries during the diastole of the heart. The diameter is about 1.5 to 5.2 millimeter. The left coronary artery is larger in caliber, as you can see, and supplies more myocardium. These arteries are functional end arteries, though their branches anastomose with each other, but one cannot compensate for the other artery in case of thrombosis. The origin of the posterior interventricular artery determines the dominance of the artery. Sympathetic stimulation dilates the intramuscular arteries and constricts the epicardial arteries. The right coronary artery position. The right coronary artery is smaller than the left coronary artery, as you can see, arising from the anterior aortic sinus of the ascending aorta. Here. Course: it first passes forward and to the right to emerge on the surface of the heart between the root of the pulmonary trunk and the right auricle, as you can see over here. It is more clear in this picture. It then runs downwards, into the right anterior coronary sulcus to the junction of the right and the inferior border. It winds around the inferior border, right? So you can see that this is the right coronary artery in the right atrioventricular sulcus, between the right atrium and the right ventricle, right? And it is winding at the junction point of the right border and the inferior border of the heart. So it winds around to the inferior border to reach the diaphragmatic surface of the heart. Here it runs backwards to the left in the right posterior coronary sulcus to reach the posterior interventricular groove. Here. Okay. So the right coronary artery has coursed towards the diaphragmatic surface, from where it moves in the posterior interventricular groove. It terminates by anastomosing with the circumflex branch of the left coronary artery at the crux of the heart. Branches: right coronary artery, it gives atrial branches to the atrium, which is anterior, posterior and lateral, right? One of the anterior atrial branch, okay, is the SA nodal artery, and it arises from the right coronary artery in 60% of the cases. You can see over here, this is the sinoatrial node artery, in 60% cases arising from the right coronary artery. The right conus artery forms an arterial arcade around the pulmonary trunk with a similar branch from the left coronary artery. This circle is called annulus of Buisson's. The ventricular branches are as anterior and the posterior groups. The anterior branch lies on the sternocostal surface, as you can see, while the posterior branch over here traverses the diaphragmatic surface of the heart. This is the posterior branch. The right marginal artery arises as the right coronary artery crosses the right border of the heart. You can see over here the right acute marginal artery. It runs along the inferior border till the apex of the heart. The posterior interventricular branch arises close to the crux of the heart and lies in the posterior interventricular groove. It is giving out septal branches to posterior one-third of the interventricular septum. Also supplies the atrioventricular node. Here, area of distribution of the right atrium, right? This is the anterior surface of the heart, ventral view. You can see the right coronary artery arising, right? This is supplied by the right coronary artery. Now, this is the acute marginal artery, branch of the right coronary artery. This patch is supplied by that. On the posterior part, you can see the diaphragmatic surface. The right part of the right atrium supplied by the right coronary artery, right? This is the right coronary artery over here. Whereas the left coronary artery is supplying the left part till the apex, the anterior interventricular septum supplied by the left coronary artery. In fact, left anterior descending artery, after which it gives a left circumflex artery over here. You can see that it is supplying the left border and left part of the diaphragmatic surface. Also, we have the obtuse marginal artery supplying the diaphragmatic surface and the left atrium, right? And then we had the posterior descending artery supplying the posterior interventricular septum, most commonly arising from the right coronary artery. The ventricles, the greater part of the right ventricle except the area adjoining the anterior interventricular groove, small part of the ventricle adjoining the posterior interventricular groove here. Posterior one-third part of the interventricular septum, whole of the conducting system of the heart except a part of the left branch of the AV bundle. The SA node is supplied by the left coronary artery in about 40% of the cases. Coming to the left coronary artery position, left coronary artery is larger than the right coronary artery, arising from the left posterior aortic sinus of ascending aorta. Of course, the artery first runs forwards to the left and emerges between the pulmonary trunk and the left auricle. Okay. Here it gives the anterior, this is the left coronary artery, and here it is giving the anterior interventricular branch, which is running downwards in the groove of the same name. Further continuation of the left coronary artery is called the circumflex artery. You can see over here, circumflex artery. After giving off the anterior interventricular branch, the artery runs to the left